How long do dental bridges last? Dental bridges are a well-known and reliable method of replacing dental missing teeth. They can also help restore function and the aesthetics in your smile. What exactly is the length of time you count on a dental bridge to last? In this clip, we'll explore elements that impact the longevity of dental bridges as well as offer a few tips regarding how you can maximize its lifespan. 1. What is a dental bridge? Before we dive into the lifetime of dental bridges, let's first clarify what they are. Dental bridges are a prosthetic device which is utilized to fill in the gaps created by a tooth that is missing or teeth that are missing. The bridge is made up comprising 2 or 3 crowns which can be placed on teeth in the area of the gap, referred to as abutment or abutment, and false teeth known as pontics, and are attached to crowns, and are used to fill in any gap created due to the absence of a tooth or teeth. Dental bridges can be constructed using a variety of components that include metal, porcelain, or a mix of both. They are made to be customized to the dimensions, shape, and color of your natural teeth. 2. Factors that can impact the lifespan of a dental bridge. A variety of factors influence the length of time a bridge can last. They include oral hygiene. Proper oral hygiene is crucial to the lifespan of dental bridges. Inability to brush and floss often can cause formation of plaque and bacterial within the bridge. This may cause tooth decay and gum infection. It is crucial to scrub all around the bridge thoroughly using the specially designed dental floss or an interdental toothbrush to eliminate any food debris or plaque that could build up. Diet. Having a diet rich in acidic or sugary food will accelerate the degradation of the components used in dental bridges. By avoiding these foods while maintaining a balanced, nutritious diet could prolong the lifespan of the bridge. Grinding and clenching practices like grinding your teeth or clenching them may put a lot of pressure on your bridge, which can cause it to crack or break loose. If you are prone grinding or to clench your teeth, having a customized night guard fitted when you sleep will assist in protecting the bridge. Regular dental examinations. Visiting your dentist on a regular basis for cleanings and checks is vital to ensure the overall health and durability of your dental bridge. The dentist is capable of assessing the state of your bridge and take care to address any problems prior to them becoming dangerous. 3. How long can you expect a dental bridge to last? In the average, a dental bridge lasts anywhere between 5 and 15 years or longer, provided it is maintained with care. The longevity of a bridge depends on a range of aspects, including the type of material it's constructed from, where you place the bridge within the mouth, and also the quality of care that it gets for. Porcelain bridges can be longer lasting and durable than bridges made of metal, since they're less vulnerable to cracking and wearing. However, they may be costlier and may not be appropriate for everyone. Bridges situated behind the mouth and will be subjected to greater bites and chewing pressures could be less durable than bridges that are located at the upper frontal area of the mouth, which have less pressure. It is important to floss and brush regularly around your bridge, keeping away from the sticky, hard foods, or visiting your dentist to have regular cleanings and checkups could aid in prolonging the longevity of your dental bridge. 4. What happens when a dental bridge needs to be replaced? The moment a dental bridge is at the limit of its life or shows evidence of wear and tear or wear, it could need replacing. Replacement of bridges is the same as how it was initially placed on the bridge. It typically will involve removing the existing bridge and making a brand new one that is sized to the existing teeth of the abutment. Your dentist will collaborate with you in determining what is the best option in replacing your bridge, according to your personal desires and needs. The bottom line is that dental bridges offer a long-lasting and reliable solution to replacing the missing teeth and also restoring your smile. When you are taking maintenance of your bridge, as well as following the recommendations of your dentist on maintenance and routine checkups, you can ensure your bridge is in good condition for years to the future. If you're concerned about the lifespan of your bridge or have issues regarding it, you should make sure to talk with your dentist to get individual guidance and assistance.